Hello and welcome to this week's episode of the Science or Fiction podcast, the podcast that interviews researchers to separate the science from the fiction in news headlines. In this series, we're focusing on mental health. I'm your host, Catherine Bates. I'm currently a youth development researcher at King's College London, and this is the Science or Fiction podcast. First, a content warning. In this episode, we discuss mental health issues in general, specifically anxiety, depression, self-harm, and eating disorders. If you're affected by any of the issues discussed, we've included resources on our website, www.scienceorfiction.co.uk. Also, just to note that we're not talking about individual cases of mental health or other issues. Instead, we're talking about the research in general and what the evidence shows. In today's episode, we're going to be tackling the ever-controversial topic of social media use and young people's mental health. Is there evidence behind the claim that social media use damages young people's mental health? Let's find out. Social media has become a huge part of our lives over the past 2 decades. We use social media to post updates between friends, to make and build relationships, and even to do shopping and to search for new information. While all of this can be positive, there are also some serious concerns. These include exposure to unrealistic portrayals of bodies and lifestyles, exposure to bullying and even exploitation. The relationship between social media use and young people's mental health has been the subject of a lot of research in the past decade, but the evidence is mixed. Despite some alarmist suggestions that social media could damage young people's mental health, including leading to increased anxiety and lower well-being, there's also now evidence to show that these findings could be negligible in practical terms, suggesting that we might not have to worry about social media. Although the research field has not yet come to a conclusion, these research findings are frequently reported by the news, and this is often on digital platforms as short articles with catchy headlines. In this format, details of the research are lost. We need to know the nuances of the research findings to make our own conclusions and decide for ourselves what action to take. In this episode of the Science or Fiction podcast, I'm interviewing researcher Louisa to get some answers. Before we introduce our guests, let's hear a few of the headlines. Social media damages teenagers' mental health, report says. BBC, January 2021. Teenage social media use linked to less life satisfaction for some. BBC, March 2022. I'm very excited to welcome our guest, Louisa Farsi.
Hi, Louisa. Welcome to the podcast. How are you doing?
Hi, Catherine. Very good, thank you.
It's great to have you here. So, can you tell us a bit about what you do before we get started?
Yeah, sure. So I'm currently doing a PhD at the University of Cambridge, where I work between 2 departments, the MRC Cognition and Brain Sciences unit and the Department of Psychiatry. And my research mostly focuses on understanding how social media use is related to mental health in young people. And I specifically focus on what are these links in clinical and non-clinical populations. So adolescents that are actually suffering from mental health conditions on the clinical spectrum as compared to adolescents that are not. So we're trying to understand these differences.
Excellent. That's so interesting. So I guess a lot of the time this research is like adolescents on average rather than having a look at the different mental health conditions that could be at play.
Exactly, yeah. Most of the research is often run on community samples, meaning that you have adolescents from the general population. So you might have some adolescents that are struggling with mental health conditions, but those are just part of a bigger sample. So there's not really a lot of distinction between different groups.
Great, let's get into it then. So why is there so much controversy over whether social media use is affecting young people's mental health?
Yes, so I think a lot of the controversy really arises from the question itself and how we ask it, rather than necessarily the answer. Oftentimes people ask the question, like the big question, does social media use affect mental health? Assuming that there's actually just one answer to it, yes or no. So we want to know if social media use affect mental health, and we assume that we can just get to one simple answer. And I think this is really where the controversy starts to arise. because the question most likely does not have a simple answer. And this is definitely what also seems to be the case when we look at the research out there. The second issue is that also when asking the question, does social media use affect mental health? We take oftentimes, and this is also what we observe in the headlines often, kind of a monolithic view of social media and mental health. So we describe social media as if it's one thing and mental health as if it's one thing. And we try to understand the relationship between these two big things without really going into the nuances of what social media and what mental health really means. And if we take this monolithic view, it becomes very hard to get to one question, because most likely, actually, there's not going to be a single question about social media being good or bad for mental health. Also because there's not really a single social media and a single mental health that we can be specific about. So eventually, I think the controversy arises from the fact that the question, does social media use affect mental health, is really a scientifically unanswerable question. And I often make the analogy with another question. So let's say somebody were to come to me and say, Louisa, can you actually test what is the effect of drinking on mortality in a research context? And then I would have to actually start thinking like, okay, you want me to test what's the effect of drinking on mortality? Is it drinking water? Is it drinking apple juice? Is it drinking alcohol? And then they could say, I'm actually interested in the effect of drinking water on mortality. And then still it wouldn't be it, because I would want to know how much water. Is it 1 glass of water? Is it 2 glasses? Is it 1,000 liters per day? Because that certainly will kill you. And then they could say, oh, it's just like a glass of water. And then I would want to know, what is the source of the water? Is it from the tap? Is it directly from the river? So it's very similar when we ask the question, does social media use affect mental health? What social media are we talking about? Are we talking about the time you spend on social media? Are we talking about the content you see on social media? And similarly, what type of mental health are we talking about? So when again we think of the big question, does social media use affect mental health? I don't really think we're gonna ever get to an answer to it. So it's really a scientifically unanswerable question. And that's why maybe a lot of controversy arises, because we get all of these mixed views and ideas about how and why social media might be affecting mental health, but we don't really get specific about what social media and mental health really mean.
Yeah, that makes so much sense. And it's actually way more complicated than just that really simple question. Does that mean then that in the research, is it often like a single social media use measure and a single mental health measure? Is that what comes up the most? And what is it normally? Is it like amount of social media use? Is it ever split between the apps? Or and then the same with mental health, is it like anxiety symptoms, or is it sometimes a range? But is it basically reflecting what you just said, like you just have the one measure, but that doesn't actually make sense?
Totally. Yeah. And that's exactly the thing, that oftentimes what you read in the news headline is social media use affects anxiety. And then when you actually look at what the studies are studying, what they study is oftentimes self-reported time spent on social media. So this is the most common proxy of social media use that research studies use. And what this means is that young people are asked the question, how much time on average do you spend on any social media platform on a typical day or on a weekend? And then they have in brackets like Facebook, Snapchat, Instagram. So putting together all the apps, and they have to answer self-reporting. So on a Likert scale from 1 to 5, oh, I spent between 1 and 2 hours, between 3 and 5 hours, etc., up to 7+ hours, for instance. So this is the mostly common metric that the studies are using to measure social media, which is first relying on time spent, and secondly, relying on self-report. So there's a bit more studies now coming out that are actually tracking smartphone usage or time spent on a certain app, but it is still less common compared to self-reports. And then there's a whole new story when it comes to mental health, because most times we're looking again at questionnaires, self-reports, which is quite common in the literature, because that's the most common measure we use of mental health. We ask people how they're feeling. most studies looked at well-being and life satisfaction. So how is your well-being, or how satisfied do you feel with your life? And it's again on a Likert scale from 1 to 5. And then there's also quite a bit of research that is looking at anxiety and depression. So questionnaires of symptoms of anxiety and depression. And importantly, most of these studies, even if they look at anxiety and depression, they do it again in a community sample. So in a group of adolescents from the general population, which is quite different from asking anxiety and depression type of questions in a clinical group.
In terms of a community sample, what exactly does that mean? And is it usually like a huge sample, or is it like 20 people? What's the most common?
It varies very much depending on the studies. So I have to say that in the social media literature, there's a lot of studies with quite big samples in the thousands, even sometimes 10,000s, because oftentimes this data is collected through national surveys. So those are surveys that are representative of the population of a certain country. Oftentimes it's Western countries, so there's quite a lot of bias in terms of sample diversity. This is a problem that we know to be there not only in the social media literature, but is definitely found in social media research as well. And oftentimes, yes, so those are like big national representative samples, around thousands of people. And then there's, of course, also smaller studies, but there's quite a few studies in the thousands where adolescents are asked usually the amount of time they spent online on social media. And then there's a bunch of questionnaires about mental health.
Interesting. Okay, so that is actually like that has some pros in the sense that a huge representative sample can lead to some like representative conclusions. But then, like you say, you don't get the nuances of how much that person might be suffering from a mental health condition or not. So I guess before we move on to a specific example, what are some of the really important research findings in this area that we should actually know about?
Yeah, so I can talk about it, what I think are like 3 of the most prominent and established findings. The first one, as I mentioned, because most of the research is focusing on time spent on social media, is about time spent. So this is what the most of the evidence that we have is about time spent. And what we know is that screen time, so generally spending time on your phone or on your screen and spending time on social media, has small associations with well-being, life satisfaction, and mental health. So it seems that there's not big associations between the amount of time you spend on social media and your well-being. So here we're talking about associations, not yet effects. So what this means is that if I spend a lot of time on social media, then usually this is not greatly affecting my well-being. Associations are small, but most times negatives. So if I spend more time on social media, there's a slightly decrease in my well-being, but this could also go the other way around. So actually, if I'm feeling a bit sad, I have a bit of a lower well-being, then this predicts me using a bit more social media. So most of the research is relying on correlational studies, which means that we look at associations. So we don't know about the directionality, although there are some research that now looks into effects, and it seems to suggest a similar trend. So that actually there's small effects, sometimes negative, from social media to well-being and mental health. So more time spent on social media leads to lower decreases in mental health, but this lower decrease seems to be quite negligible in size. So we're not talking about a huge decrease in well-being and mental health. So this is kind of the first big finding in the field that has been replicated across multiple studies.
Yeah, I just want to pick up on some really important points there. So one being that we're currently, or most of the studies are currently looking at associations. So that means that making the claim or the conclusion that social media damages young people's mental health is not yet substantiated. Is that right? And
Absolutely.
The second really important thing is, I think it's really interesting that it can also be the other way around. Like you might be, if you're feeling low, you might turn to social media to chat to friends or do whatever on there to make you feel better. But again, is so just to get my head around it, that's also an association. So we also can't conclude going on social media when you feel low will make you feel better. But we can conclude there's an association that people that feel low, if they use a lot of social media, they tend to feel better, right?
So it's mostly that if people feel low, then they go and spend more time on social media. We don't know then how exactly. We don't know then how that makes them feel. So the association goes, if I'm feeling more low, then I go and spend more time on social media. Or if I spend a bit more time on social media, then there's a slight decrease in my well-being. But again, we're talking about very small effects in this case. And also, the second thing that I would like to discuss that kind of follows on your point is that actually there's a lot of variability depending on the uses and the users. So it's very hard to establish a dose-response relationship whereby we say this much increases social media is generally causes this much decrease or increase in well-being. So there's a lot of variability, and there seems to be that some adolescents are differentially affected by others, which taps again on the point that the research tends to be on these large community samples, but there's not a lot of focus on the specific subgroups when it comes to mental health, but also when it comes to other factors that might be interested. I guess maybe later we are going to talk about potential age and gender differences. So only now the research is starting to get into how different groups might be differentially affected. But generally, we're taking adolescents as a whole, whereas I think more research needs to be done looking at the specific subgroups. And then I guess the third thing I want to focus on is that there is not a lot of research about the content that adolescents are exposed to on social media and how that is affecting mental health, which is probably a very interesting question that we as researchers definitely want to know about. It's much harder to get data on content exposure because you would need to actually look at social media data and what are the different posts that young people are exposed to. What seems to be quite established is that appearance comparison on social media, so comparing your appearance, and here we are mostly talking about bodies, to others, seems to be associated with lower self-esteem and lower body satisfaction, particularly in girls. So I think that's also another finding that seems to be quite established.
The content point is really interesting, isn't it? Because I think that's what kind of comes into the worry about social media, especially from like parents and practitioners. Some of the work I've done looking at practitioner perspectives on young people's experiences is that they're really worried about the increase in social media use being linked to like exposure to exploitation, but also bullying between friends. And that's a real concern for them. But then when you speak to a young person about social media use, they're often not concerned about their use or how they're using it. So I think, yeah, that's just a really important point, that we need to know what the content is and the experience of that to understand how it's maybe going to affect young people.
Definitely. And I think what's important to realize is that most of these headlines that discuss research studies oftentimes don't look at content, which is actually what we would be interested in knowing, right? It's mostly just time spent. So it's putting together all of the things that you might be doing on a social media platform. But if I'm using like YouTube to, sometimes I check my statistics, like how much time did I spend today? And it's like, I don't know, 4 hours. And I'm like, wow, 4 hours on social media. And then I see like 2 hours on YouTube and I actually did like 2 hours of yoga. Like that's very different than watching maybe harmful content on YouTube. And it's the same. If I were to spend like 1 hour on Instagram, but I'm actually looking at inspirational content, there's research that hints to the fact that inspirational content is actually associated with higher mental health. So if people explore their interest, that's also associated with higher mental health. So there now seems to be a bit more research into the fact that we need to diversify what young people are doing online, because there's some types of uses of social media that are associated with higher mental health compared to other types of usage that definitely can be harmful, like cyberbullying or exposure to self-harm content. And there's the blurry line between where there's content that in itself might be neutral, but that for some people might be actually harmful. For example, if I'm exposed to food content, for some people it might not be triggering, but for a person that has a predisposition for an eating disorder, continuous exposure to food content might be. So there still needs to be research about these distinctions.
Yeah, brilliant. Thank you. Right, so let's get into the specifics. In each episode, we dive into the research behind a specific headline. And this week, we're going to discuss the research from colleagues in your research group that has been covered recently in the following news articles. Teenage social media use linked to less life satisfaction for some, BBC, March 2022. Does social media make teens unhappy? It may depend on their age. New York Times, April 2022. So can you just briefly summarize the main findings of this study for us?
Yes, sure. So this was a study that, as you mentioned, was run by my research group. I was not directly involved, but we talked a lot about the findings, because they kind of were very interesting in terms of all of these different groups and differential associations and effects that social media use might have with mental health. So this study was an analysis of two big UK data sets. So we're talking again about big samples, which is very good because then we can look at effects across people that are representative of the general population. So this was a study that first looked at 84,000 participants across the ages from 10 to 80, so a very large age span. And it looked at the cross-sectional relationship, so at associations between self-reported time spent on social media and life satisfaction. And it found that these associations, so we're not talking about effects yet, just the association between time spent on social media, self-reported, and life satisfaction was mostly negative in younger adolescents across the lifespan. Whereas in other age groups, this association didn't seem to be there. And also that sex differences in this relationship were only present during this time. So that actually girls and boys seems to show differential associations during this time, and that also there was an inverted U shape in this association. So people that tended to spend more and people that tended to spend less time on social media, so those are the extremes, seem to actually show more negative associations with well-being. Then what is very interesting was that the study followed up on this and not only looked at associations, but also looked more into the effects part. And this was possible because there was longitudinal data available. What this means is that you didn't only have data about a single time point, but there was data about multiple time points. And in this case, the study looked at 17,000 participants from the young group. And it hinted to the fact that there might be distinct developmental time windows for which social media is specifically affecting life satisfaction. So there might be specific ages at which social media is exerting a higher effect on life satisfaction. And what the authors found here was that actually these windows occur at different ages in males and females. So the effect of social media on life satisfaction was happening at age 14 to 15 in males, but it was happening a bit before in females at age 11 to 13. So it seemed that there was this kind of switch in terms of age, whereas females were affected before and males were affected after. And then there was also a window at 19 years old, 90 would be a bit too old, where both groups, so both males and females, were affected. And lastly, what I think is interesting that we already discussed before was that not only social media seem to have an effect on life satisfaction, but also the other way around, that a small decrease in life satisfaction also predicted a subsequent small increases in social media use. But in this case, there were no age or sex differences.
Fascinating. It sounds like a huge study, and there was lots of different analysis in there. So a few things to unpick. The first thing is, can we just define the difference between cross-sectional analysis and longitudinal?
Yes, definitely. So a cross-sectional analysis is an analysis where you look, for instance, in this case, at social media and mental health at the same time point. So you ask a person, how much time do you spend on social media? And you ask them at the same time, how satisfied do you feel with your life? And then you collect the data. So what this means is that you have no temporal dimension there because you know about social media and life satisfaction at the same time, which makes it very hard to tell what comes first. In a longitudinal analysis, in the other hand, you have them separate. So you ask about social media and mental health first at one time point, and then again you follow up at a second time point, at a third time point, asking again about their social media and mental health. And what this allows you to do is to look at time patterns. So you can see, how does social media time point 1 link to life satisfaction at time point 2 and vice versa? So you can track these effects throughout time because you have this time dimension as compared to cross-sectional data, which kind of has everything together at a single time point.
The other thing that I thought was really interesting, it kind of plays into what we talked about a little bit at the start, but it's really interesting that it's very little social media use and heavy social media use that can have these associations. So I'm just interested into what you think that means. So I guess that kind of suggests that, in a sense, a certain amount of social media use is a good thing. Is that right?
Yeah, it does. That's exactly what the association within that. Again, we're talking about association, so it's hard to say like we're talking about whether social media is affecting life satisfaction or vice versa. But what this seems to suggest is that actually people that are using not a lot of social media, they seem to have a lower life satisfaction. And this could be for many things. There's research that now is starting to go in terms of also like digital exclusion. So because there's so much going on social media, when actually young people are not using them at all, they might feel excluded from their peers. So this might be a potential explanation, but there's really not a lot of evidence now to make any claims of this kind. And then, of course, for high social media use, there might be a lot of reasons, one of which could be that it displaces time from other activities. So the highest social media use, I think, was 7 or more hours on social media, self-reported. So that's quite a lot of time, which means that you can't do other things that might be beneficial for your mental health, like exercising, engaging in offline social interaction. But the middle part of social media, so when you spend on average, like I think there it was between 2 and a bit more hours on social media per day, that doesn't seem to have negative associations with life satisfaction.
The other thing that's super interesting is like potentially these windows in development that could be different between boys and girls, males and females. So in what way might that be useful for us to know? Like what can we do with that information if we know that there's kind of a more sensitive time at certain time points? And then also second part of that question, I think the 19-year-old one is super fascinating because there's like a bit of a transition around then.
Yes.
So we're like leaving education and going on to work or going on to university. I just think that's really interesting. I'm interested to hear what you think.
No, definitely. So starting from the 90-year-old, I think it was very interesting the fact that in both males and females, this was the same. So you observed exactly at the same age, this slight decrease in life satisfaction predicted by social media use. And in that case, probably we're talking about a transition period that both males and females are experiencing. You're going to university or you're starting a job, you might move out around that age. So it's a sensitive period in that sense because a lot of changes are happening. And it's also interesting that in ages before, there was actually this difference between males and females. This could be due to the fact that females start puberty a bit before than males. So this is known to be, there's known to be biological changes that start before in females. And what was observed is that actually social media was leading to lower life satisfaction before for females than for males. So this might be associated to the fact that females are entering puberty around 11 to 13, whereas for males, pubertal development happens later, so 14 to 15. And maybe during these sensitivity windows, social media might actually have stronger effects, and we might need to be a bit more careful. How and why? I think it's a very complex question that I don't know yet how to answer, specifically because we don't know what type of social media we're talking about again. Like, we know it's about time, but what is the content that people are exposed to? What kind of activities are they engaged in? And I think without that sort of information, it's very hard to say what can we do about social media relation to mental health in these specific time windows. Because I would expect that it's not, let's stop any type of social media use, or let's just restrict the whole of social media. It might just be that we need to redirect social media use towards a certain type of content or towards a certain type of activity that actually decreases this potential sensitivity. And for that, we definitely need more research.
Yeah, so there's lots of small pieces to the puzzle to still put together to understand this interaction, for sure. I guess a more general question, or a broader question now, but in this study, or the way that it's reported in the journal article, and in actually many others, we kind of touched on this at the start, but the authors report that the effects were significant but small, and should be considered carefully. So can we just talk about a little bit about what that means and how we can make conclusions from it?
Yes. So you touched on a very important point that still raises a lot of controversy in research. So sometimes we have lab meeting when we go on and discuss about this for hours, because there is still a hot topic in research. A lot of studies are mentioning the fact that, we find something as significant, but then also it's small. And usually in research, when you say something is significant, it means it deems to have attention, because it's very unlikely to be happening by chance. So actually, if a finding is significant, we expect that something is going on there. However, now, with the advent of big data and big data sets, what happens is that we are having increasingly access to a lot of data. And in this data, oftentimes there's a lot of associations between different factors. And it's often the case that we actually find a lot of things being related to each other, just because you're measuring so many things together that it's very likely that you find a lot of associations. So then these ideas comes up that it's actually we're finding a lot of associations, a lot of them are significant, but are they really meaningful? And especially in psychology, because everything is associated with everything. We're talking about biological factors, social factors. We know that we live in a very complex world where everything is really interacting with everything. We need to start considering, there are all these sorts of interactions, but are they really meaningful? Do we really need to care about it? Do we really need to make a policy change or advise teachers and parents about these significant associations? And this, again, becomes a controversial topic in social media research, because oftentimes what we see is that, yes, there is an association or there is an effect, but it's very small. So there are these small changes, and I think we are not yet sure about whether that small change is telling us something meaningful and important, or it's actually just a fluctuation, you know, and it's an association that it's not making such a huge impact. So I guess it's still a bit difficult to define. And this also taps into the fact that when we look at clinical studies, for instance, a lot of research is saying, oh, there might be an effect on depression or anxiety, but this is not clinically meaningful. What this means that on an anxiety or on a depression scale, you see a small increase in depression, but that's actually not meaning that that person, like the people that have been tested, are a higher chance of having depression on a clinical level, so of receiving a diagnosis. So would you say that we have to still be careful about it, and we need to actually see it as important, or is it maybe a bit less important because actually it's not clinically relevant? So I don't know if that answers the question or creates more answers, probably the latter.
No, it's super interesting and super clear. I think that's often the way that that's kind of the whole point of having this discussion, is because a lot of the time you can make a bigger claim or a big conclusion sentence out of a small effect. And it's exactly that thing of like, but how meaningful is it, especially clinically in the context of mental health? So just to clarify a bit more, when there is a small association or a small effect, does it essentially mean that there's lots of other things going on that we haven't looked at in that context? So there's lots of other factors that can also be having an effect.
I think that's hard to say. When we find a small significant effects, what this means is that something is going on. So it's very unlikely that that effect or that association is happening by chance. But because it's very, very small, we are not sure whether still that's meaningful in theory and for us, right? So it might be that such a change is very unlikely to happen by chance. But then when we really start to thinking, okay, but what does an increase in like 0.5 or 1 point in life satisfaction on a 5-Likert scale mean? Then we're not sure how to interpret it. Like, what is this telling us? Is this really meaningful? And is really more about the interpretation and about what we deem as a meaningful effect. And that's why now a lot of the discourse around this in research is about, we need to define before. What do we think is a meaningful effect before we actually test it? So that then, if we said before, I think that actually an effect this big is actually meaningful, and we find that it's significant, we can say it's significant and meaningful. But if we find a very small effect that is significant, we have already defined before that actually that effect might not be meaningful. And by that, we are protecting ourselves against then carrying out a study and like peeking afterwards, oh, this might be an effect that is significant, but maybe it's not meaningful, depending on our biases or depending on what we already think. So I think it's important that researchers think before actually carrying out these experiments, what is a meaningful effect, and then carry out the study. And that can already arise from discussions and really discussing together, what do we think is a meaningful effect?
So I guess the point is that this small effect could go from feeling somewhat anxious to slightly anxious. And it's like, yes. Well, what does that mean? And I guess kind of to finish, where should we go next with this research? Like, what do we need to study in order to better understand this relationship between social media use and young people's mental health?
Yeah. So many things. I don't even know where to start. I have like a long list in my head. Yeah, so I think this is a research area there has been already, I think, around 10 years of research, but there's still so much to be done. And of course, science is cumulative. So we want research to first replicate and to show whether some effects are consistent, to then go on and explore new avenues. When it comes to what I think is important, and we already started discussing about it, is first research on different groups. So research on clinical groups is very important. There's not a lot of studies that look at adolescents that have a diagnosis or that have a history of mental health conditions or that are experiencing a mental health condition when they're being studied. And this is very relevant because I expect that there we might find that specific types of social media use might have differential associations to mental health. So I already brought some examples like exposure to food content or to thinness ideal might be particularly detrimental for a person that has an eating disorder, but not necessarily for a person with anxiety, for which actually the amount of social feedback that you receive might be triggering. And this might be, again, different for a person with depression, for which instead, and this is all potential hypothesis, right? We don't know yet about this. A person with depression might actually be more triggered by passively scrolling through social media, and is like passive scrolling as compared to active engagement. So we need to start differentiating these different types of social media and these different mental health conditions. And this also will allow us to look into mechanisms, which is something very interesting that research hasn't really done yet. And that goes into asking the question, well, social media has an effect on mental health, might have an association on mental health, but why? Like, what's the mechanism behind the effect or the association of social media use on mental health? Is it because of the feedback that you receive? Is it because of the time that you spend? What are these mechanisms? And this is often what research tries to do, to really understand why is something affecting something else. And only when we understand why, we will be able to manipulate something to see whether it changes, right? So the ultimate goal of research is to actually establish causality. So these effects, like, can we really say that if I wiggle something, something else will wiggle? So is it the case if I wiggle social media, if I manipulate it, then mental health will also change? And to do that, we can't manipulate the whole of social media. We need to manipulate something specific. We need to manipulate maybe a mechanism. So we might want to run a study where we manipulate a mechanism like the amount of like that you receive, or the amount of time that you spend scrolling, or the type of content that you're exposed to. And then we observe how does that manipulation affect mental health. So this is something that is yet to be done. And I think it's going to be very interesting because it's really going to show us what these effects, what is underlying these effects.
So the why is a really big question. And
yes.
Also the individual factors of who is being affected and in what context and with what content is also really important. I think this is really interesting because a lot of the time it's almost flipped the other way around in social media research, because a lot of the time in psychology research, you start really small and with the specific manipulations. Whereas with social media research, I guess because of the national surveys you were talking about, we have these huge general samples, which are brilliant, but then we don't have the nuances and the very specific measures. So it's interesting that it's started at the other end and now it's going backwards down to the why and to the mechanisms.
Yeah, that's true. Actually, I never thought about it that way. It's very interesting because in a lot of psychological research, you actually observe exactly the opposite, that studies are so specific and then everybody's like, oh, but you need to go a bit bigger. And whereas here, yeah, it's exactly the opposite. And also, I think that has to do with data availability. We're talking about a lot of data that is also very hard to access. It's not easy to access data from social media platform. There's a lot of sensitive and personal information, and it's a lot of information in and of itself. And also it's very hard to access it when it comes to social media platform and actually getting the data. So that has made it very hard for researchers to be able to address these questions. So it's also going to be important in the next years to actually possibly get access to this data to start asking questions like that.
So we've come to that time in the episode, the very big question. Social media damages young people's mental health. Is it science or fiction?
I think, as I mentioned at the beginning, we can't answer this question. Like, it's not a question that we can really address as a whole. So far, what we know is that time spent on social media doesn't seem to damage mental health substantially. There's so many things that, so if we're talking about effects of time spent on social media on mental health, and headlines that say, oh, spending time on social media makes you depressed, I would say no. Like, we don't have evidence to hint at that, especially if we're discussing depression as a clinical condition. And oftentimes, it's not very clear when we're talking about depression, what really type of depression are we talking about, or anxiety, etc. So I think we can't really make those claims that time spent on social media is causing mental health problems. But also we don't know a lot of other things about, maybe there might be stuff about social media that are having detrimental effect, as well as there might be stuff about social media that are having very good effects on mental health, through exploring your interest or being exposed to inspirational content. So yeah, that's in short my answer. Does that? It's don't ask a researcher about about like, oh, is it yes or no? Because oftentimes it's like, it depends, maybe.
Yeah, but I think that's a sign of a good conclusion and a good researcher. Better than going like all the way in with, yes, it's definitely this, when we don't actually know that yet.
Yeah.
Brilliant. So I guess before I let you go, do you have any recommendations for our listeners if they want to find out more on this topic?
Yeah, so there's an article, which is an annual research review that I think was very inspiring, at least for me, to read and to really understand what are the nuances when it comes to social media and mental health. So this is an article by Candice Odgers and Michaeline Jensen, and it's entitled Adolescents' Mental Health in the Digital Age: Facts, Fears, and Future Directions. So it's an annual research review, and taps into like what are some facts, but also what are some fears and future direction for research, and really tries to disentangle what is it that we know about social media and what are all the things that we don't know in terms of its relationship to mental health.
Brilliant. Okay, great. We will link that on our website. Great. So thank you so much, Louisa, for coming onto the podcast today. And thank you all for listening. Such a fascinating conversation. I hope you enjoyed it.
Thanks again to Louisa for coming on to the podcast today. You can follow us for updates and more information on Instagram and TikTok at Science or Fiction Pod, and on Twitter at Sci or Fiction Pod. If you want to get in touch, or if you have a suggestion for a future topic, you can email us at info@scienceorfiction.co.uk. And as always, you can find the recommendations from the researcher and links to resources for mental health support at www.scienceorfiction.co.uk. Finally, I would like to thank King's College London and the Wellcome Trust Public Engagement Grant for funding this series on mental health. Thank you to Afra Din for helping me to produce this episode. Thank you to Kit Studio for the branding and to Jamie Johnson for the music. See you next week.